What's up, everybody? I'm Katie.
And I'm Morgan.
And this is For Your Misinformation. We are two Midwestern feminists here to break down the political news that you need to know without the misinformation that you don't.
Let us break down the problem and tell you what we're doing and what you can do to help solve it.
Hi, everyone. This is the first episode. I am recording as a fully vaccinated person, and I could not be more thankful or excited. I did like a backyard Easter hang and I got a little sunburned. Like it feels like, I don't know, feel hope. We are going to try something different this week. I know that one of the biggest problems that I see right now is vaccine hesitancy, and that's not to like blame anybody, but it is an issue because, the more of us are vaccinated, the healthier we are, and it shouldn't be up to just one group of people to protect everybody. So we need everybody to get their vaccines as quickly as possible. So this is going to be an episode about vaccine hesitancy from the podcast Shelter in Place. It's a pandemic-born podcast focused on transforming communities by first transforming ourselves. The host is Laura Joyce Davis. She's an award-winning writer and a Fulbright scholar and created the podcast as a way to reclaim a life that was upended by the pandemic. Each episode in this series explores a different question about vaccine hesitancy. So we're going to air the very first episode. It's called Trials and Tribulations. And this first episode examines what information we need to make good decisions, and it includes interviews with nationally renowned infectious disease specialist Dr. Joyce Sanchez and health journalist Garnet Henderson, who was a phase 3 participant in the Pfizer vaccine trial. Episodes 2 and 3 are out now. You can check those out at Shelter in Place, the podcast, wherever you get your podcasts. And those episodes 2 and 3, they cover the intersection of vaccine history and systemic racism and the challenges of navigating misinformation. So I think you guys will like that. I'm going to do a little bit of housekeeping before we go into the interview. Elections are tomorrow in Illinois and in a bunch of other states, but I couldn't find a list. I'm really sorry. So if you have elections coming up, please vote. Illinois is a pro-voting state. We have a Democratic trifecta, so you can register. They passed a lot of voter protection laws that make it easier to vote. So you can register at the polls. You just have to bring 2 pieces of ID, and one of them has to have your current address on it. And guess what? Our elections are just as secure as they are in states like Georgia and Iowa, where they're trying to suppress the shit out of voters. So weird, huh? It's almost like those laws aren't about election security at all. It's important to remember that just like with everything, there's a continuum of vaccine acceptance, and you don't know where people are on the continuum. The ultimate goal is to enable people to be able to make scientific and evidence-based choices using the latest data when thinking about their own health during the pandemic. I don't know. Just keep that in mind. It's always more complicated than you first think. It's not like people are either vaccine avoidant or 100% on board. Like sometimes they fall somewhere in the middle. And I think the more it's our job to I don't know who's us, but I feel like it's really important to give them the information that they need to make their own decisions. Because there's just no other way of doing things. Without further ado, I hope you like this episode, and I will check in with you guys when it's over.
This is Shelter in Place, a podcast about coming together in a world that pulls us apart. From Oakland, California to Hamilton, Massachusetts, I'm Laura Joyce.
All day and night, I heard sirens. I felt like people were dying all around me. And I live alone, so I was also terrified of dying. because even though I'm young and healthy, I heard all these stories about people with COVID who felt okay until they were on death's door. And I felt like if that happened to me, I would just die because there's nobody else who lives with me who could call 911 for me. I would weigh fear of the vaccine with the very real consequences of getting COVID. I got the vaccine. My fear is not gone, but I don't lie awake at night anymore worrying about dying alone in my apartment. I would choose that any day over the risk of getting COVID.
So much of this past year has been marked by fear, but lately I've been feeling more hopeful. In the last 6 weeks, new coronavirus infections have fallen by almost 70% nationwide. For the first time in a while, health professionals are making predictions that actually sound optimistic. They're talking about summertime, about returning to some sense of normalcy, about maybe even seeing the end of this pandemic. But beneath all of that optimism, there have been other conversations. When a pregnant friend who's an essential worker in hospitality decided to get the vaccine, she opted not to post it on social media because she'd already received criticism from some of her friends who were worried about the vaccine's safety. Others feel disgruntled that they aren't getting their shots first. Misinformation is so rampant today that it can be tough to decipher between truth and fiction. Our near constant consumption of information, combined with the daily grind of a very long pandemic year, has caught us in an exhausting cycle of suspicion, confusion, overwhelm, and fatigue. According to a new poll from the Associated Press, NORC Center for Public Affairs Research, 1 in 3 Americans say that they definitely or probably won't get the COVID-19 vaccine. Among the top concerns are the speed at which the COVID-19 vaccine was developed, fear of side effects, and distrust of pharmaceuticals and the government. This poll is highly concerning, especially to the experts who say that vaccinations are necessary to reach herd immunity and end this pandemic. Beneath our views on vaccination are bigger questions. Do we have the right information to make good decisions? Does that information match or contradict our personal experiences? Can we trust that the information we're getting is even true? Today, we're going to tackle the first of those big questions. What information do we need to make good decisions? If you combine my extended family with my husband's, together we come from no less than 10 essential workers in medicine, which is to say that I have no excuse for not being more knowledgeable when it comes to all things medical. Medicine was the background noise to my childhood, the conversation that floated down the hallway between my open door and my parents late at night, the topic of almost every dinner conversation. But maybe because medicine was always there, I often tuned it out. As an adult, I regret that sometimes, like when I'm reading in the news about COVID-19 vaccine trials and realize that I don't actually know as much about that process as I thought I did. To help me close the gap in my understanding, I turned to someone who understands vaccines well.
I'm Joyce Sanchez. I'm an infectious disease specialist, a physician, a mother of 2 beautiful children, a wife, and daughter of an epidemiologist and pharmacist.
Joyce directs the travel clinic at Freighter and the Medical College of Wisconsin. Long before COVID-19, Joyce was anticipating this pandemic. Whenever there would be any sort of outbreak, Joyce and her colleagues would follow it closely so that they could give recommendations to any of their patients who had traveled internationally and may have been exposed.
When we first heard about an unknown pneumonia in Wuhan, China, we were keeping tabs on that pretty closely. And then as things spread around Southeast Asia and eventually Italy and the United States, it was something that I suppose as an infectious disease specialist, I was always preparing for, but never actually imagined that our world would be living through. So when it happened, it was surprising, but confirmation that what I'm doing is meaningful and can have a huge impact. I love one of the statements made by the World Health Organization, or WHO, and I'll just quote them here. The 2 public health interventions that have had the greatest impact on the world's health are clean water and vaccines. I don't think anyone would argue that clean water is a good thing, and vaccines are up there on the list too. Of all of the medical disciplines, when we talk about clean water and vaccines, Those are the two biggest public health measures that have saved the greatest number of people in the past 2 centuries. I'm just so grateful to be part of a community that values that. What's happened has been life-changing, obviously, for everybody, but very validating for me in the field that I've chosen.
Like me, Joyce grew up in a medical family. I know Joyce because she married my brother, who incidentally is also a doctor. But while I was tuning out conversations about medicine, Joyce was tuning in.
I really have to credit my parents who fostered my interests and supported me every step along the way in my education, my training and career. My father has a career in infectious disease surveillance with the Department of Defense. His experience really opened my eyes to how cool infectious disease is.
Until I met Joyce, I never understood the appeal of infectious disease, but learning that only clean water has done more than vaccines to improve our global public health has shifted my understanding. I think Joyce is right. Infectious disease is cool. It's an area of medicine where we've made a ton of exciting progress. I should say up front that I am not hesitant about vaccines. But when I sat down with Joyce, I expected that Joyce would probably say they were pretty good, but there was still a lot to learn. What she told me was so much better than what I'd expected.
When we think about evaluating safety, there are a couple of things that I like to talk to my patients about. The first is that clinical trials today are the most vigorous that we've seen in the history of medicine, certainly at least in the United States. We actually have a lot of data now. Back in the summer when we were going through phase 1, 2, 3 clinical trials, we didn't have a lot of data, but at least as of this recording, over 40 million people have been vaccinated, and that's just in the US. When we think about the globe, we're talking about more than 100 million people who have received at least one dose of the mRNA vaccines.
There's been a lot of talk about these phase 3 clinical trials in the news. I trust Joyce when she says that those clinical trials are more vigorous today than ever before. But I also wanted to understand better what those trials actually look like. So we spoke to someone who had experienced them firsthand.
My name is Garnet Henderson. I'm a professional dancer and a freelance journalist in New York. I participated in the Pfizer vaccine clinical trial. I'm a science journalist and a health nerd. I was really interested in this race to produce a vaccine, and I was particularly interested in the mRNA vaccines just because it's a whole new technology and it seemed really exciting to me.
A quick note here about mRNA vaccines, also called messenger RNA vaccines. mRNA vaccines are a new type of vaccine, but researchers have been studying them for decades. Traditional vaccines put a weakened version of the disease into our body so that we build up antibodies to fight off that disease. But mRNA vaccines work differently. When we get that injection in our upper arm, that shot delivers a set of instructions. Those instructions teach our cells how to make a harmless piece of protein called a spike protein that's found on the surface of the virus that causes COVID-19. That spike protein triggers our body to make antibodies. It's the same response that happens when we're actually infected by COVID-19, but this way, we can make those antibodies without risking the serious consequences of getting COVID-19. As a science journalist, Garnet already knew about mRNA vaccines, so she was excited when she saw an opportunity to be part of a clinical trial that would test a new COVID-19 mRNA vaccine.
I actually got a Facebook ad looking for participants to join what I later learned was the Pfizer clinical trial, which is an mRNA vaccine. I filled out the little survey and I kind of forgot about it. And then I got a call from Pfizer, and then once they determined that I was eligible, then I got a call from the actual test site. They went through another short questionnaire with me, and then I went in for the first appointment.
That first appointment was back in mid-October, when predictions about vaccine approval were still cautious at best. Trials like the one that Garnet took part in have given us some really important data. But Garnet said that when she was participating in the trial, she got a lot of questions from people in her life who had concerns.
I got a lot of questions from people, and people who aren't really skeptical of vaccines. a lot of questions that reflected to me the fact that most people just don't know that much about how vaccines work, and also that people don't know how clinical trials work, which is understandable because most people have never participated in a clinical trial. Like, I got lots of questions about, did I even know that it was a vaccine trial I was participating in? And I would explain to people, oh, of course. You don't know whether you're getting the vaccine or the placebo, but you know everything else. At the first visit, the lead investigator of the study, the doctor who was running that test site, came in and sat down with me and went over all of it and asked me if I had any questions, any concerns. The informed consent process is very involved. They really make sure that they have all the information about any medications that you might be taking, any past bad reactions to vaccines, any chronic illnesses you have that they need to know about. But before they do the injections, they tested us all for COVID. There was a nasal swab. And then they also took a blood test, which they said was to establish our baseline antibodies, because a lot of people, especially in New York, may have had or been exposed to COVID, even if they didn't know that they were sick. Because I was an eligible candidate, I got an injection that day, but it's a double-blind study. That means that I didn't know for sure whether I was going to get the vaccine or the placebo. The placebo in the study was just saline. And then there is a nurse or nurse practitioner who's the one who injects you, and that person does know. So it's a different person who comes and gives you the injection. And then they had us wait for 30 minutes afterward. They do that to monitor just in case anybody does have a serious reaction. And then you leave. And I came back 3 weeks later and essentially did the same thing again for the second dose.
Garnett's second dose was in early November, more than a month before the FDA would approve the first COVID-19 vaccine.
I think it's really cool that I got to see what a clinical trial looks like from the inside. This might sound kind of simplistic, but my first impression of the whole thing was that they were just incredibly organized. I'm certainly no great fan of pharmaceutical companies, but I was like, wow, I really can tell that Pfizer just does this all the time. And that did make me feel good because they clearly had this whole apparatus in place.
I found this incredibly helpful, to pull back the curtain on this process and hear from someone who'd actually experienced it, not as a doctor, but as a trial participant. And Garnett said that the smooth running of that Pfizer machine didn't stop when she got her second shot.
Another part of the study is that we report any COVID symptoms or positive COVID test results every week. And there's an app. So you just download this app and then it prompts you every week, hey, fill in your diary.
This was something Joyce talked about as well, not just for trial participants, but for anyone who gets the vaccine.
There's a very robust reporting system for adverse effects. For those who do get the vaccine, as long as you're plugged into some kind of internet where you can get notifications to report your symptoms, that has actually been scrutinized very rigorously and very regularly by entities that are outside of pharmaceutical companies. Entities like the American College of Immunization Practices and the FDA are looking at these and making sure that there's no signal for something that is going to be consequential and may pause us from continuing to administer vaccines. The CDC recently published a report looking at the early safety monitoring findings, and as far as serious allergic reactions, which is the biggest concern for most people, it's exceedingly rare. We're talking about 11 cases per million. So that's very, very, very low. And when we think about general vaccines like tetanus or flu, historically that ballpark is in the 1 to 1 million doses that there's a severe adverse reaction. So really good, promising statistics here. And again, over 100 million doses of these vaccines.
Garnett said that she did experience side effects that we now know are common, but that they didn't last for long.
I had a pretty strong reaction to the second dose, so I kind of knew that I had gotten the vaccine even before I was officially unblinded. And it wasn't anything bad or scary, it was just the side effects that I think everybody is now aware are really common with the second dose of both the Pfizer and Mrna vaccines. I felt really tired. My body was really achy. I didn't actually run a fever, but I kind of had the chills. I was having trouble sleeping. And then the day after I got the second dose, my injection site was red and swollen, and my lymph nodes were a little bit swollen in my neck on that side. So that's how I kind of knew that it probably was not my imagination. It probably was not the placebo effect. I probably got the real thing. And I do think that Pfizer and Moderna both have done a decent job of communicating this, that there are side effects that are associated with these vaccines that are a bit stronger than what most of us are used to from other adult vaccines.
When the Pfizer vaccine was approved in December, Garnet already knew that she'd probably gotten the real thing and not the placebo. But knowing that didn't prepare her for how she would feel when the vaccine was approved.
I actually cried. It sort of surprised me when they first released the efficacy data for the vaccine. I just started crying. I live in New York City, and it was absolutely terrifying to live here in late March and early April. There's a hospital right up the street from me. All day and night, I heard sirens. I felt like people were dying all around me. And I live alone, so I was also terrified of dying. Because even though I'm young and healthy, I heard all these stories about people with COVID who felt okay until they were on death's door. And I felt like if that happened to me, I would just die because there's nobody else who lives with me who could call 911 for me or help me get to the hospital or even to the urgent care that's a block away. As a young, overall very healthy person, I'm low priority in so many ways. I'm low priority for vaccination. If I had gotten COVID, I probably would have survived. And so that's part of what made me feel like I really should participate because I can. And I felt like I'm a safe test subject. I trusted the science, but I also felt like if it turns out that there is some kind of complication that can result from having this vaccine, I'll probably be fine. They need to test a vaccine like that in as wide an array of people as possible. I participated in the trial out of curiosity and because I felt like it was something that I could do. So it did make me really emotional when that turned out not just to be an effective vaccine, but to be like the vaccine, the first one that got approved. I had no idea when I signed up for the trial that that's what was going to happen.
Joyce had a similar reaction. She'd hoped that some of the trial vaccines would be effective, but the results far surpassed her expectations.
Many of us in the medical community were frankly holding our breaths for phase 3 clinical trial data to come out in regards to safety and efficacy because these had not been used on a global scale before. When that came out and we saw this glimmer of hope with really, really good efficacy, that was one thing that surprised me because most of our vaccine performances, when we think about flu vaccine, batting average is maybe 40 to 60%, which is still something better than zero, but not the best when we think about vaccines. And when you hear 94 or 95% effective, that is just amazing. And that's where I saw a glimmer of hope when we think about how do we get over this pandemic.
I just want to pause here to make sure that you got that. 94 to 95% effective. When you look at our most common vaccines, tetanus, polio, MMR, most of them are somewhere between 93% and 100. Even in this early stage, our currently approved COVID vaccines have numbers almost as good as some of the most effective vaccines ever made. I found this fascinating, that the numbers were so much higher than I'd realized. Most of us don't worry about the efficacy of vaccines like polio. We take it for granted that that disease is behind us. Hearing that we're in a similar place with these COVID vaccines now is the first time in a long time that I've felt hopeful that the end of the pandemic is coming. I asked Joyce if it was reasonable to think that we'd return to some sense of normalcy, or if we should brace ourselves for more of the same in years to come, for future pandemics.
Well, that's the million-dollar question. If we look at the past 30 years, about every 10 years has been the average, where we had SARS, and then we had MERS, and And then we have this. It's been 10 years. So we'll see. Is it going to be every 10 years where we get some major new strain? Maybe, but who knows? And then we have flu. So are there times where we may be dealing with two pandemics? That was a big question last spring. Are we going to deal with flu? And interestingly, all of the measures that we've taken to help protect ourselves against COVID has really protected us against flu. So we didn't have to deal with two pandemics, which is great. I've been surprised at every point in this pandemic, surprised for the worse and surprised for the better. But there's a lot to be hopeful for. The drops in the number of cases, at least in the US, the number of hospitalizations, the number of deaths. And this is happening at the height of freezing weather, at the height of people being indoors, at the height of the winter blues post-holidays. The fact that we're seeing this drop is amazing to me. This is the time where flu season really runs rampant. It's January, February. That's where we see big flu spikes traditionally, and that we're not seeing that. We're not seeing COVID continue to rise. Gives me hope that people are getting immune, people are getting vaccinated, and while the distribution process hasn't been perfect, at least the needle is moving forward. I hope that's a motivator for people to say yes when it becomes available for them to receive the vaccine.
One of the fears that's commonly voiced right now is about how effective the vaccines are against variants of the virus. Joy said that these variants are not a surprise, and that this is an area where the mRNA vaccines give us a huge advantage, since they can be produced in a lab quickly and in large quantities.
That is something that we expected from day one. That's what viruses do. It's normal for them as they replicate. There'll be certain mistakes that happen, and that's just by chance. And occasionally there is a mutant where it gives it an advantage, maybe more infectious, as is the case with some of these variants of concern that have come from the UK or South Africa, Brazil. That's where we really want to ensure that our current measures, our current vaccines, our current therapies are still able to do what they should be doing. These mutations have caused them to be more contagious. So if one person gets infected with one of these variants, they're more likely to spread it to more people than the former variant. What's promising is that our immune systems are really amazing. They form these antibodies, and it's a rich population of antibodies. It's not just one clone of antibody. And even with variants, a lot of the lab data, as well as some of the population data, show that these vaccines that we're using, even if they were not formulated for these variants initially, the immune systems that people mount are so rich that they can still recognize and neutralize and reduce the severity of disease and reduce the hospitalizations and reduce the deaths. We're keeping a very close eye on variants as they come up. These won't be the last variants. As long as this virus is multiplying and spreading, there are opportunities for more variants to come up. But thankfully, so far, we haven't seen anything that has caused us concern for these variants to escape protection from the currently available vaccines. That might change. I hope it won't, but if it does change, then we are in a position where these currently available vaccines can be manufactured very quickly. If you get the genome, you can manufacture the vaccine in a lab with these platforms. It doesn't take months like influenza vaccine where you have to grow virus. These are vaccines that can be manufactured quickly. So that's one advantage of these platforms.
Garnet says that getting vaccinated hasn't taken away all of her fears. She's still being careful, wearing a mask, social distancing, trying to be smart. But the vaccine has given her something that has been on short supply in this pandemic. It's restored her hope.
Which is something that I had kind of forgotten how to feel. My fear is not gone, but I don't lie awake at night anymore worrying about dying alone in my apartment. Even though the vaccine is approved, they still are following us for 2 years because now they're turning to new questions like, does the vaccine prevent asymptomatic transmission, and how long does the immunity last? That's another thing that I hope will reassure people, that it's not that they developed this vaccine really fast, got it approved, and then bailed. The study is still ongoing. If I were to have any problems, I have an on-call number for a doctor with the study to call. They're very much still involved with us and monitoring us. I would encourage people to weigh their potential fear of the vaccine with the very real consequences of getting COVID or giving COVID to someone else so that even if you live, they might die. I would encourage people to weigh those two things against each other. And at least to me, the potential risks of the vaccine, which we know are incredibly low, I would choose that any day over the risk of getting COVID. I understand people not having faith in institutions, pharmaceutical companies, and our government. I don't think Pfizer is a good company. I don't really trust them either. What I do trust is the doctors and the other scientists and the nurses and the medical assistants and the administrators who were working at my test site and who were working so incredibly hard to save lives. I chatted with the people when I was there. A lot of the nurses in particular were people who worked on the front lines in the spring in New York, and then they went to work at this vaccine test site. I trust them and I trust their work, and I trust that they wouldn't have been involved with the trial and the development of the vaccine if they didn't believe that it was safe and effective. You see so much about the fear and the what ifs, and you just don't see as much of the excitement and the joy that comes along with just reveling in the fact that humanity did an incredible thing. We created multiple effective vaccines for a new disease in less than a year. That's amazing. That's something to be really excited about and not to fear. These vaccines were built on decades of work that were done by scientists who have nothing to do with any of these pharmaceutical companies, who worked on this stuff for decades when their research was terribly underfunded, and it might not ever have been used were it not for this horrible pandemic. I have trust in them, and so where I don't trust institutions, I try to look for the people that I can put my faith in.
We talk a lot at Shelter in Place about transforming communities by transforming ourselves. Garnet transformed herself in a very tangible way. She took part in a clinical trial that had the potential to end the pandemic, that ended up being one of the most hopeful moments of progress in the history of vaccination. As is often the case, there was risk involved. It could have gone wrong. But without people like Garnet, we wouldn't be where we are today. We'll hear from Garnet and Joyce more in future episodes, but in the meantime, I want to end this episode with an invitation. For better or worse, the decisions that we make for ourselves and our families do have an impact on our communities. We are interconnected, whether or not we want to be. Sometimes that interconnectedness can feel like a burden. It can feel overwhelming, but ultimately, it's a gift. What if the question we're asking ourselves weren't what's best for ourselves and our families, but what's best for our community, for our country, for our world? The answer to that question might just give us what we need to face the long months that are still ahead. They might just help us to push past the fear of these trials and tribulations and instead find our way to being able to celebrate the good and hopeful things that are happening all around us.
All right, that was Shelter in Place with Laura Joyce Davis. I really enjoyed listening to that episode, and not just because we have the same middle name. So my thoughts after listening to that, I'm a big fan of setting realistic expectations, and at this point, to me, it seems like vaccines are our best way out. Which, just further confirms what we already knew, that Dolly Parton is a hero. But for real, I feel cautiously optimistic. I am worried about a fourth wave. I am worried about some variants, but variants are to be expected. And if we find out that there is a variant that's not covered by the vaccines that we already have, pretty easy to modify the vaccine so that it does inoculate you against the variants. May need a booster in 6 months or a year, but no big deal. We will take that in stride as it comes because we don't mind updating our views when presented with new information. I do feel like people are already playing it real fast and loose with the CDC guidelines, like combining multiple households. like, if you're a vaccinated person, you're probably okay. But like, people are already like combining multiple households that have unvaccinated people because some of the people are vaccinated, and it's like, oh, that's not at all what the CDC said. So I don't know, like, it's all loosey-goosey and it makes me nervous. Behaviors really shouldn't have changed that much. Vaccinated people can travel, but it's not really recommended. They definitely didn't say, hey, go back to normal. Especially if you're unvaccinated, it's important to wear. Well, no, I shouldn't even say that. Like, for everyone, until we learn more, like, let's operate in an abundance of caution. But yeah, wear a mask, stay 6 feet apart, avoid crowds, get vaccinated as soon as you can by whatever shot you can get your hands on. And I mean, absolutely figure out what kind of low risk stuff you can do to meet your social needs that haven't been getting met, but try to do it safely. And remember that you're not fully vaccinated until 2 weeks after your second shot of Moderna or Pfizer, or 2 weeks after your only shot of Johnson & Johnson. I had kind of a hard time, not a hard time, but like was faced with a choice that was hard yesterday because it was beautiful here. And I just assumed that our Easter hang thing was going to be outside. And then people were inside. And there were 2 people in there who were unvaccinated from separate households. And I know, like, I love rules. I mean, like, I love rules that are in place for a reason, and I hate rules that are in place for stupid reasons. But like right now, having a rule about who can be inside about a pandemic, that seems like an okay reason to me. And like Clark and I and his mom and everybody was so nice about it, but I just was like, are they not wearing masks? Like, I don't want to go in there if they're not wearing masks. Like, I just, like, that's not what the guidelines say. Like, and it was hard. And like, Clark handled it like a champ. And he was like, let's just let's set up. Cause it's early April. Obviously, it's like where I live, it's just starting to get nice. And I'm sure it will go back to not being that nice soon. But today it's like 73 and sunny. And yesterday was too. And Clark was like, okay, let's just get out their like patio furniture, which was in storage. And I was like, oh my God, I don't want to be annoying. But then again, like, there's a pandemic. So anyway, we did. It took probably like 20 minutes, if that. And like, actually, it was probably kind of a favor to his mom and her boyfriend, because who wants to take out their own patio furniture and put all the cushions back on and stuff? Probably not them. So everybody ended up sitting outside, and I felt much more comfortable, and I think, it was fine. So I guess the moral of this story is be safe even if you feel like you're being annoying. Also, this is kind of a side note, and I don't want to ignore that, like, the Derek Chauvin trial is going on right now. It's really hard to watch. It must be even harder to watch as a person of color. I hope everybody is taking care of themselves whatever way you can. It feels like gaslighting, because like we watched him on video murder a man, so it's confusing why we're even on trial. I mean, I understand, but it just feels like gaslighting to me. I put that there because I wanted to end with happier news than that. So there is some good news to talk about. Interior Secretary Deb Haaland announced the creation of a new, if maybe long overdue, but maybe it would have happened sooner if this hadn't been the very first Native American secretary in American history. Womp womp. But no, I mean, yay for Deb Haaland. She's creating a unit within the Bureau of Indian Affairs to investigate missing and murdered Indigenous women. Like, amazing. And reminder, 84% of Native American women experience violence in their lifetimes, and murder is the third leading cause of death for Native girls and women between the ages of 10 and 24. So that's just some bonkers shit. I mean, I know we did a whole episode about it. You could go back and listen to it. That's what happens when you elect qualified women. They get shit done. They recognize the actual problems. Meanwhile, Republican legislators in Arkansas or Alabama or whatever are like, we don't want trans girls to play sports. And it's like, oh, is that a real problem? Is that happening a lot? How many times has that happened? Oh, one time in your state, it's in the last 20 years in your state. Okay, yeah, there's real problems. Like, that girl just wants to play sports. Like, why are you, like, just leave her alone. There are real problems. There's missing and murdered Indigenous women. And Deb Haaland is like, fine, I'll take care of the missing and murdered Indigenous women. Stacey Abrams is like, ugh, there's all this voter suppression. I'll take care of voter suppression. Like, the real problems that are happening. And then Republicans are like, wait, what? Can we instead talk about Dr. Seuss? Or trans people are still scary, right? So that's what's happening. If that's what it feels like, you're not crazy. That's what's happening. And then let's see, what am I doing for democracy this week? Well, I got an email that my mail-in ballot was accepted, so that is good. I am also a poll worker on election day for the very first time, and I'm excited about that. Oh my gosh, on Wednesday, don't tell anybody, I'm going to a Zoom legislative training session for a group called Parents for the Protection of Girls, which like sounds fine, right? Like, yeah, girls should be protected, in favor of it. Be more specific. What are we protecting them from? Oh, well, Parents for the Protection of Girls, the whole reason they exist is to fight repealing parental notice of abortion. So I'm a spy. I'm going to go to their meeting to hear them talk about how they're going to fight against repealing the parental notice of abortion and see what's going on. But I don't know, it's just like, it's for real a group of parents like fighting to make sure young women who they'll never know have harder. Oh, I hate it so much. Again, it doesn't impact anybody except for the people that it hurts. And it's just, you can trust young people to make their own decisions. You can trust women to make their own decisions. So I am so curious. I am so excited to go to that meeting and see what's going on. And I keep thinking about, what do you wear? Like, what does an anti-choice person wear? Like, how do they do their makeup? Do I do my makeup like a pro-choice? I mean, I hope people look at me and assume I'm pro-choice. Oh my God, I should take out my nose ring. That's it. That's what I'll do. And I'll go light makeup. And they'll be like, she looks like any other girl from my church. I'll wear a frilly dress. I don't know what I'm talking about. Are these hurtful stereotypes? I have no idea. But yeah, I can't wait to go and tell you how it goes. see what they're up to. Oh, and then I'm donating blood on Friday because I'm finally fully vaccinated. I haven't donated blood in like more than a year. And the news I'm sure everybody has been waiting for, our foster cat had her kitten. It was just one kitten. I waited for like 5 hours to see if the kitten, if she would have another kitten. Like, the birth happened so fast and she handled it like a champ. We've been calling her Lady Otter Bunny because she looks kind of like an otter and a bunny. But she had her kitten on March 30th. And then she just like laid there and napped and the kitten nursed for like 5 hours. And I was like, damn, when is this other kitten gonna drop? And I texted the vet and the vet was like, seems like she's just having the one. I was like, oh yeah, that makes sense. So we have a little baby kitten. We've been calling it Baby Otterbean. It'll be 5 days old when you hear this episode, and it is gaining weight like a champ. It's a little chunker. I'll put some pictures on Instagram. I'm trying to be more active on Instagram because it's not that scary. Like, you guys are nice. Why would I? So silly. So if you do anything this week, vote. If you're in a state that has elections coming up, if you can't vote, get your COVID shot, get whatever COVID shot you can get your hands on. And I really appreciate you guys listening, and I will talk to you again next week. Hey, piggies, are you excited to get vaccinated? Thank you guys so much for listening to For Your Misinformation. If you haven't already, please subscribe to the podcast, and if you like it, give us a rating and a review.
It helps us find more listeners, and the more of us there are, the better. And make sure you follow us on Instagram and Twitter at FYMI Pod.
Shout out to Ben Schlofelt for the audio production, Hope Dye for the podcast art, Kyle Dibdahl for the intro and outro music, and Adam Roston, who edits these videos every week so you can watch them on YouTube.
We come out with new episodes every Monday.